The DV Alert program has been designed to actually upskill and give anybody who's working in the medical or allied professions skills to be able to recognise domestic violence and family violence in all its forms, to be able to respond to that in really appropriate ways, and then to be able to refer on in, again, really appropriate ways for the survivors of domestic family violence. Participants throughout the DV Alert training are actually telling us that they thought that they may have, had clients or patients that were experiencing family violence or domestic violence, but they may not have been too sure as how to broach the subject, or even if their gut instinct was right. So after the training, they actually then recognised that their gut instinct was right, and now that they have the skills and the tools. And so I think the prevalence is probably a lot higher after they've actually done the training. However, domestic violence and family violence is very prevalent in all our communities and in all our cultures. People who are working in the medical and allied professions, unless they've actually gone off and sought specific training around family violence, domestic violence, they don't feel that they have the skills. Sometimes, though, in coming to a training like the DV Alert, we're actually teaching people it's not so much about knowing everything about domestic violence, family violence. It's actually about being brave enough to actually go deeper and to find out why the bruises, why the continual, admissions into accident and emergency, why the kids are behaving in this way. So again, they've always had those feelings, but it's actually about giving them, I guess, the skills and the courage and the strength to be able to ask the harder questions, and then to be able to refer on if they need to. Every contact that I've had with people or workers that have gone through the DV Alert training, they all say the same thing, in the sense that they've been given more courage and more strength to be able to use the tools like asking the hard questions about domestic violence, family violence, and to also be able to have some education in their hands to be able to share with their clients or their patients in regards to debunking the myths, in regards to being able to refer appropriately. So all the participants actually go away with a lot more skills to pop into their toolkit to be able to pull out and be used at the most appropriate times. Every opportunity I have to be involved with DV Alert, whether that be through the online learning or whether that be through actually facilitating face-to-face workshops, I'm never failed to be amazed at the strength of such amazing, passionate, dedicated workers. And again, workers that, once given the skills, are able to do such amazing work in their communities. So I'll always be grateful for these opportunities, because we are so lucky that we have amazing people in the community to be able to support any survivor going through domestic and family violence and getting them the help that they need to begin that healing process.